Hi there, everybody. My name is Dr. Christine Anderson, and I am a chiropractor in Los Angeles, California. My specialty is pediatrics and pregnancy, with a further specialty in neurology, and I am also a homeopath. I use essential oils. I am way down deep into frequency. There's a lot of things that I use in my practice to help to support the body and health and the healing processes. And this is one of the reasons why I absolutely love fevers. Now, I have 3 children. They're now adults, but as young children, occasionally, thank goodness not very often, they would have a fever. And because I know how much fevers benefit the body and the immune system, I did everything that I could to help support their fevers so that their bodies could heal. And before you know it, they didn't have a fever anymore. So I'm going to share some of that with you. I'm going to go down the causes of fever, what actually comprises a fever, how you take a temperature, fever physiology, so you understand the mechanism behind fever, so that when I talk about the benefits of fever, this will all make sense. Now, I'm also going to go into the danger of fever medications, what we call antipyretics, and then I'll delve into a little bit about natural remedies for fevers to help support the fever process. And, possibly if there's a problem with fevers, things to look out for. And we're going to do everything fever. So let's just dive right in. So first of all, what is a fever? Well, the definition is a raising of the body temperature above normal. Now, we'll get into what normal is in a minute, and I've got quotes there because really, what is normal? But a fever is not a disease, all right? So we're not really wanting to treat a fever. A fever is a symptom. It's something that comes on when your body is fighting off something or reacting to something. So it's a sign of immune system functioning. It's one of the primary defenses that we have. And so this is, again, what we're going to talk about as far as its benefits. So with a fever, you might get a rapid heart rate, you might be dizzy, you might have shivers and chills, you might have pale, clammy skin, sweating profusely, fatigue. All these things are symptoms that might occur along with the fever. And pretty much, of course, the way that you're going to know is that your temperature is going to rise up. So let's go into a little bit about the causes of fever. So really the number one cause, especially in children, are viral infections. Now, any type of infection can cause a fever because the body is mounting an immune response. So things like sinusitis or pneumonia or urinary tract infections, gastroenteritis, skin infections, anything with an infection process can cause a fever. Anytime you are overheating the body, whether you are putting too much clothes on, or you are out in the sun and overheating yourself, you can raise your body temperature. Certain medications can do this: cancer, autoimmune disease, toxins, including things like drug abuse or alcohol, vaccination. So all these types of things can occur. And I also put teething on there because although this is not generally recognized as a cause of fever, I really know that this occurs. Now, it's usually not a super high fever with teething, but it can cause an immune response and a fever to occur. I know that for my children and the children I see in my practice. So the definition of a fever. So normal, again, I'm going to put in quotes there, is a range, and I've got both the Fahrenheit and the Celsius. So 97.5 Fahrenheit to 99.5 Fahrenheit would be considered a normal oral temperature. And here's where we get into the differences with temperatures in the body. So your core temperature, if you go internally, is going to be higher than, say, your armpit. So in the mouth, it would be a fever would be considered at 100 degrees Fahrenheit. Under the arm would be 99, so it's usually a degree difference. And then in the rectal, it's going to be even higher because, again, our internal temperature is higher. So it will be 100.4 degrees Fahrenheit or 38 degrees Celsius. So this is where the definition of a fever begins. So a low-grade fever would be up to 100.3 degrees Fahrenheit, moderate fever to 103 degrees Fahrenheit, and high over 103 degrees. So the degree of fever does not necessarily dictate the amount of severity of the problem. So you can't say, oh, high fever, big problem. That doesn't work in this instance. Now, it is our body temperature that we're talking about, and this is going to vary with age. So children tend to get higher temperatures, and they tend to have higher body temperatures in general, especially smaller babies. So, and then as you get older, it goes down. General health, if you have health issues, your temperature could be higher or lower. Your activity level, certainly if you're more active, you're going to have a higher body temperature, the environment, if it's sunny, hot, that type of thing, and the time of day. So our temperature is highest in the late afternoon and the evening. And I don't know if you noticed this, but when my children had temperatures and fevers, that they would get hotter as the day went on, and then they would wake up and they would be cooler. So much cooler in the early part of the day and the nighttime. And then as the day went on, temperatures could come back again. So this is why fevers might look like they're going. And then as the day goes on, the parents are like, oh, it came back again. I go, yeah, because there's a natural rhythm to our body temperature. So can a fever get too high? And I know this is a concern for so many people because they associate that a fever is just going to keep climbing, that there's no mechanism, it's not going to stop, and the brain is going to fry, and there's going to be brain damage. But this really does not happen in a healthy child. And we're going to talk about the physiology in a second of fevers, but our brain has an internal mechanism. There's a regulatory system to keep the temperature from going too high. And this is the beauty of our body. Everything is built within it. As long as we are allowing these natural processes to happen, and we're not creating problems around that, everything will work really well. Now, for the body temperature to get to up above 108 degrees Fahrenheit, which is where brain damage can occur, this is usually when there is outside circumstances, like you're getting overheated and you're out in the sun and you're not hydrating and you get heat stroke. In that instance, the brain's mechanism, that system it has, that safety system, is not going to work. It's going to be cut off. So this is where you can get into danger. And then if you have a health issue with a central nervous disorder, there can be a problem too, because central nervous system is the brain. If you have a brain issue, it might not be regulating things so well. So you want to make sure you don't let your child overheat in the summer. Don't put your babies in the direct sun. And also watch out about overdressing babies, especially newborns, because they cannot regulate their heat. And sometimes just because you're cold, you think the baby is, and they're running hotter and you're piling clothes on them, and they can overheat that way. All right, there's different ways to take temperatures just to make things really fun. And so I have a graph here from the American Academy of Pediatrics, their thermometer recommendations by age. So there's different thermometers to use in different places. There is a digital thermometer now, so you should not use the mercury thermometers that used to be around. The digital ones came on the scene during my children's childhood. I can't remember exactly when, but just make sure that you have one separate if you're doing oral temperature and another separate digital one for rectal. Even if you're cleaning them, make sure you keep those separate. I also recommend getting covers for your thermometer. So they're little plastic sheaths that you can stick on, and then that way it's going to make things so much easier to keep it sanitary. So the smaller the child, you're probably going to take the temperature different ways. So for babies, the standard is the rectal temperature. So you just want to use some sort of lubrication, and you only want to go a little of the ways in, maybe a quarter of an inch, a few millimeters, not very much. And until a child is probably, 3, 4, 5 years old, until they can handle putting the thermometer, the digital one, in their mouth and having it stay there, because it might take a little time for that reading to occur. There's also the axillary, which is the armpit. And this one is really not that reliable, so you might use it as a screening tool just to do a quick check. But if you really want to be sure, you want to do digital in the rectal or the oral, or you can also use the temporal or tympanic. Now the temporal is looking at the temporal artery, what's going on there. So that's at the side of the head here. And you would just follow the directions. And then in the ear, there's one that you can check for the tympanic membrane. So those are their reliability is so-so. I do use them for a quick check, but if you really want to be sure, you want to use the digital with the rectal or the oral. The two that are really not reliable at all are the pacifier thermometer and the strips on the forehead. Again, you can use those for screening, but they're not recommended if you really want an accurate temperature. All right, now we're going to get into the fun of the physiology of a fever. So in this slide here, you can see on the left-hand side, I've got that list again of the causes of fever. So basically, if there's something going on, say there's a viral infection going on, then there's going to be sending signals into the bloodstream. And when you go into the bloodstream, then those signals are going to be stimulating macrophage, neutrophils, dendritic cells. These are all our first lines of defense, our innate immune system. And then you'll see at the bottom there, what that does is that creates something called pyrogens. So pyrogens are going to go into the bloodstream, up to the brain, into the hypothalamus, which is deep into the brain. And then that's going to stimulate the hypothalamus to send out prostaglandins. And those prostaglandins are things that mediate the inflammatory response. They can be pro-inflammatory or anti-inflammatory, but they are going to then cause the effects that we see with fever that creates the fever, which are decreased heat loss that is magnified by the neurologic system of producing norepinephrine to make the blood vessels constrict. And this way when you constrict blood vessels, then they're not giving off heat. And it also will help to increase our heat production by ramping up our metabolism, and that's helped along by the neurotransmitter acetylcholine. So there's a neurologic involvement in here as well. And right at the top middle, that guy there with the gosh, it looks like a white turkey, but that's the brain with the brain stem. And there's a little black dot there signifying that that is where the hypothalamus is. So this is the system that is involved, and it's the checks and balances. As our heat rises, then it's going to send a feedback system loop in if we don't need a fever, if we don't need our system raised. So let's say the threat or the viral infection is taken care of, then you're not going to have so many macrophage and dendritic cells and neutrophils producing pyrogens, and therefore the hypothalamus won't be stimulated to create the fever anymore. So that's sort of the physiology and the loop that goes on, and this will also come into play when we talk about things that can be supportive of a fever. All right, just a little word about fever phobia, and this is in regards to what I was talking about with fevers and a study, 91% of parents thinking fever can cause harm to their child. And 89% of parents are using fever reducers before the temperature even reaches 102 degrees. Even pediatricians in Massachusetts think fevers are dangerous. With all this phobia, there's a knee-jerk response to want to medicate and drop that fever down. It's like, we got to get the fever down. I'm like, no, the fever is good. There are absolutely no studies showing evidence of a fever worsening the course of an illness or causing long-term neurologic problems, brain damage, or death. And I am going to put all the references that I use for this presentation in the description. So if you want to check this out or prove it to anybody, I've got the stuff to back it up. But there's absolutely no danger with fevers in a healthy child. And there's studies that show that. So let's talk now about the benefits. And there are so many benefits relating to the immune system because of that feedback that I talked about with the physiology. So what happens is, number one, pathogens, viruses, bacteria, molds, parasites, whatever's in the system cannot survive the heat, and that heat makes them so that they can't replicate. So when you feel miserable when you have a fever, just know that those pathogens are even more miserable because they just can't tolerate it. And so that's what I tell kids. I'm like, yeah, you feel real bad right now, but all the stuff in your body, it's helping get rid of what's causing your problem. So when the temperature rises to greater than or equal to 102 degrees Fahrenheit, interferon is produced. And interferon is a natural antibiotic and antiviral agent. So again, this is part of our system's built-in response to help deal with what is causing the fever in the first place. Fever stimulates antibody production specific to the infection. So this is because those first line of defense that come in and start the fever going, then also stimulate our second line of defense, which is the acquired immunity, and that is more specific to whatever that pathogen, that virus or bacteria is in the process of being worked on. It's going to help increase white blood cell count. It's going to help increase the speed of those white blood cells in their movement and getting through to your body to help with whatever's going on. It's going to increase that macrophage production and also the activity of those macrophages. And they're really cool because they're like Pac-Man, and they just engulf whatever pathogen is around and sort of just eat it up. Dendritic cells are affected as well. Bone marrow releases neutrophils and increases their rate of maturation, and they become something called monocytes. The fever mobilizes natural killer cells. It helps immune cells release cytokines and nitric oxide. Nitric oxide helps with vasodilation of our blood vessels and helps bring things to the body, oxygen and other nutrients. And cytokines are inflammatory products, but they are needed in the short term for healing. We just don't want too many all at once to be overwhelmed, but they are necessary in the immune response. And then there's a hygiene theory. All right, so what this theory is that if children are exposed to what we term infections, so think childhood infections, no big deal. I mean, including the chicken pox. I know now, especially now that they have the vaccine for chicken pox, not so many kids get it. But I actually do believe that these childhood diseases help strengthen a child's immune system. It helps prepare it for bigger things that they might become exposed to. So I'm not a fan of skipping that step because I do think there are some great benefits. And this is one of them with things like fever coming on. And yes, it's no fun to have a chickenpox rash, but the younger a child gets chickenpox, it's almost like nothing. My two boys had chickenpox really young, and you wouldn't even know they had anything going on. Also, exposure to things like dust, dirt, and dander seem to help also with decreasing the incidence of atopic disorders, which are allergies, asthma, and eczema. And they seem to make a child's system more immunocompetent. That means the appropriate immune response at the appropriate time. Not too much, not too little, just right. All right, so let's continue with the dangers of antipyretics, because if we have all these benefits of a fever, then why would we want to stop the fever from occurring? You're essentially cutting off the first line of defense that the body has. So think about this. All right, your child is trying to mount a fever to combat whatever it's being exposed to. You give them an antipyretic like, Tylenol or Motrin or whatever else is out there. And so it knocks down the fever and the body goes, what is going on here? And so it keeps trying to mount a fever, You knock it down, it tries to mount it. What ends up happening is this illness is prolonged because the body is going, I'm trying to get a fever going on here. I'm trying to help heal myself. So illnesses tend to be prolonged, and there's research that backs this up. So the American Academy of Pediatrics does not recommend fever-reducing drugs. So this is a little bit of a conundrum, since a lot of pediatricians, medical pediatricians, I should say, are, thinking that fevers can do damage. So there's a little bit of a disconnect there. The assumption that reducing a fever has benefit has never had any research to back it up. All the research that I read showed absolutely the opposite. It stops the immune system healing mechanism. And so what happens is that the illness is prolonged and could possibly even get worse because an immune response cannot be mounted. There was a study with the flu virus they treated with antipyretics, and there was actually a 5% increase in mortality. That's death rate. So acetaminophen, which is called paracetamol in the UK, and possibly Europe too, uh, is called Tylenol here as sort of the brand name. What that does, which is super dangerous, is decreases the antioxidant glutathione. And this is why it is responsible or possibly responsible for liver damage and failure. And you have to be really careful about acetaminophen because a lot of times they will put it in a lot of different products like cough syrup and NyQuil and, different things. So if you're giving your child multiple things that have acetaminophen in it, you can be overdosing quite easily. So you definitely do not want to exceed 80 milligrams per kilogram per day. And that becomes an issue because most people don't understand that dosing. So if you are not understanding it, you need to contact your healthcare provider and have them help you figure it out. But better yet, maybe try something else besides lowering their temperature with acetaminophen. Now, ibuprofen can cause gastritis and ulcers, and also it is possibly toxic to the kidneys, which is termed nephrotoxicity. And do not give ibuprofen products to babies less than 6 months. And as far as aspirin, most people don't use it anymore, but you should not use aspirin in children with viral infections because there is a danger of Reye's syndrome, which is a liver disorder. So just be aware of that. So what can we do to help support a fever and support the healing process? Because you don't really want to knock that fever down, even naturally. So, of course, being a chiropractor, this is numero uno on my list. It's all about support of the brain and the nervous system, which controls every single thing in the body, including the immune system. And of course, it is going to, the brain is part of this whole fever mechanism. Then there is craniosacral therapy. So the brain sits in our cranial vault made up of all these cranial bones, and if there's any restriction going on in that pattern of movement, then it is going to possibly affect the brain and the hypothalamus and its function. Now the hypothalamus is it's connected to the pituitary, which sits in something called the sella turcica, which is in one of the cranial bones called the sphenoid bone. So there's a definite connection there with using craniosacral therapy. I will also put links in the description where I talk more about craniosacral therapy because I know it can be a little, if you're not used to understanding what this is, it can be a little like, what is that? All right, homeopathy. So homeopathy is a basis of healing that is built on the premise of like cures like. And so there are a couple of homeopathic remedies that can be really useful to help support the fever, but they are based on symptoms. There's not just one size fits all with homeopathy, so it can be a little bit tricky because if you don't give the right remedy, it's not really going to work. But because it's super safe, especially with children, pregnancy, that type of thing, if you give the wrong remedy, most of the time just nothing will happen. And this is why some people go, homeopathy doesn't work. And I go, well, you probably didn't give the right remedy. So I'm going to do a separate video talking about homeopathy for fever in particular, so that I can go into a little bit more detail about the different remedies. But just know that this is a system that can be very useful, and when I do the video, I will put a link in the description, but you can also just like and get subscribed and hit the notification so that when I actually do this video, then you will get notified that I'm doing it. All right, Epsom salt bath. So you can do lukewarm baths, just plain water, just to help make your child more comfortable and, maybe relax. There's always a relaxing aspect for hydrotherapy. You don't really want to try and bring the fever down, but maybe if they need just a little bit of comfort. But if you put Epsom salts in, which are high in magnesium, then it can help replace some of the magnesium lost from the sweating of the fever, as well as help with the hydration, and it's just super relaxing. So you can do cool compresses too in this way. Just you can even add some Epsom salts into the water that you put the compresses in, just more for comfort. That's it. Now, you can add some essential oils also to the bath to help support the immune system and provide comfort. And again, I'm going to do a whole separate video on those different essential oils and how you can use them, just because there's so much information, too much to put in here. But I will put, once I do that video, I'll put the link in the description. And if you're watching this now, live, then just again, make sure you are subscribed so you get that notification. All right. I totally am into frequency right now because frequency is everything. We are frequency. Everything has a frequency. So I'm using frequency a lot in all the healing modalities that I do, as well as for wellness. But the device that I'm using, which is the Solex AO scan, I'll put a link in the description, but there are things on there, there are programs on there to play for whether it's a symptom or an issue, including fever. So I would certainly do that, as well as get the patient, get the child grounding, try to get the feet on the ground at least, outside in the fresh air and the sun. Vitamin D is important, so that sun is there. If it's in nature and out, like under a tree, even better. There's negative ions. You can use a grounding mat if you don't, or a biomat if you don't have access to be able to go outside, like if you don't have a yard and you don't really want to go very far. But the most important thing is to eliminate EMFs, and those are the negative kind. So do not let your child sit on a computer or have a device on their person while they have a fever, while they're sick, because that is going to affect the healing process. You're going to have all this negative energy coming at them that actually has more of a trauma to the body. It creates like a toxin because the body has to deal with those electromagnetic frequencies. So you want to turn the TV off, turn the computer off, get the phone, iPad, or whatever out of their room while they are trying to heal. So that's just that. We got to be, hard about this. Hydration. This is a key thing because one of the issues with fever is that heat and the sweating is going to make your child lose water. And so we want to make sure that they're drinking and taking in liquids, whether that be water itself or water with electrolytes like smart water, ice cubes, tea, broth, smoothies, popsicles made, by the way, with fruit. Don't get the sugar stuff. Sugary juices and drinks and sodas and sports drinks and whatnot are going to depress the immune system for at least 5 hours after your child has them. So ban sugar when they are sick. And they've got to rest. That's going to help the healing process. It's going to help mobilize the immune system. And this is another reason why I like fevers, because it knocks them out. If you get the fever down, they're going to feel great again and want to run around and play. And it's like, no. You want them to rest. And this is why it's really great to have the fever. It's another benefit because it knocks them out. And a lot of times when my kids were young and babies, they would sleep on me. And of course, again, talking about frequency and energy, that healing frequency of the parent. Or as they got older, they would just want to sleep in the bed with me. So whatever needs to be done so they can get that rest. You probably won't sleep, but as long as they do. Another immune support in general, especially for fevers, is a garlic and oil foot wrap. I will just put the description to that in how to make it in the description so you can see. In general, immune boosters like vitamin C and D, zinc, iodine, quercetin, which helps the zinc get into the cell, echinacea, elderberry, these types of things can be helpful for immune support. And with the vitamin C, you want to do fairly high doses. Start low, so for a child, depending on their age, look and see what it says on the label, but you want to keep giving it throughout the day to help get that level built up in the body. If their stool becomes loose, then back it up. You've gone too far. But for most of us, we need more vitamin C than we are taking in. All right, so when are fevers a concern? Now, we want them to occur, but and certainly you can try and manage a low-grade fever at home. You don't need to call your healthcare practitioner right off the bat, but you want to contact them if the rectal temperature is a certain amount depending on the child's age, and I put that in the chart there. Or if the fever is going on in a younger child over 2 days or 5 days if they're older. If their fever is high and they have lethargy and they're unresponsive. So I know their energy is going to be low, but if you're just not able to rouse them, that's a concern. If they're not taking in enough fluids and they're not peeing and you can pinch their skin and it stays in a little tent. In a baby, you look at the fontanelle and it's sunk in. They're not alert. Or if they're having prolonged vomiting and diarrhea, which can create dehydration, you want to reach out to your healthcare provider. Now, if there's a headache, painful or stiff neck, your baby's screaming, there's a rash, there's confusion, anything that might be a sign of meningitis, you want to contact your healthcare provider right away or maybe even call 911. Now, I also have listed here febrile seizure. So we're going to talk about this right now. So remember I told you that the brain has a way, a fail-safe mechanism. Well, there's a set point that the brain won't go past, but if it does, then it will want to cool the body and the brain down very quickly. And the way it does this is basically a febrile seizure. I don't like the term, but this is what it is called. And febrile is another word for fever. So it's a fever seizure, and there is a momentary loss of consciousness. Eyes can roll back, there can be shaking, twitching, or the body can stiffen. So, it does look like a seizure, but it's not typically like a seizure where you're having a regular brain disorder. And I'm going to talk about that in a second. So this is the most common seizure disorder in children. It's 2.2 to 5% of children between 6 and 60 months have febrile seizures. But typically, in most children, most healthy children with no other problems, there's no decline in IQ, no problems with academic performance, no neurocognitive issues, that's brain and cognition of, again, like IQ, or behavioral abnormalities with febrile seizures. Now, rarely are they ever recurrent either. So just because a child has one doesn't mean they will ever have one again. Except for those children with certain risk factors, like a family history of febrile seizures. So if a parent had them or a sibling had them, if they started very young, less than a year, if it is considered a complex febrile seizure, which I'll talk about in a second, or if the seizure came on with a very low-grade fever. So typically the febrile seizure will come on because the temperature is getting too high, but if it happens at a lower temperature, that's more of an issue. So a simple febrile seizure is less than 15 minutes. It's generalized. It's just once in 24 hours and no history of any other seizures or health complications or problems. A complex febrile seizure is greater than 15 minutes, more focal, so it's just one part of the brain that's being affected. And usually it will occur greater than one time in 24 hours. So what was also found in studies is that antipyretics, so fever-reducing medication like Tylenol or Motrin or ibuprofen, has absolutely no effect on preventing febrile seizures. So if you think, oh, I want to medicate my child and give them an antipyretic so it doesn't get so high so that they don't have a seizure, that's not what they found. It does not work that way. And then a little note about fever after vaccines. So fever is the most commonly reported adverse event to vaccines in the USA. And it comprises 26% of all reports received by the Vaccine Adverse Events Reporting System, which is also called VAERS. Now, I will put a link to the National Vaccine Information Center, who has a link to the VAERS database in the CDC, so you can check this out if you would like. But this is one of the reasons really why you should never vaccinate a child who has a fever or who is ill with anything, even a cold, because you are putting in a toxic substance into their system, trying to stimulate an immune response. And if they already have something going on, then it has a better chance of negatively affecting them. So also the other thing I want to talk about briefly is just consider not using antipyretics after a vaccine. So some parents will do that to try and prevent a fever. But here's the thing. A fever is, even though it's an adverse event, it's letting you know that the immune system was affected in a particular way. And I really think that's important because even though your child may not have a serious adverse event on that first shot, it may be a sign that their system will get sensitized and they could possibly have a greater response the next time. So you really do want to know how your child is reacting. The risk of febrile seizure has also been found to increase after vaccination, especially with the MMR shot. And again, I am putting all the references in the description, so you will have that for your information. All right, that's it. That was a lot of information, I know, but if you would like more information, you can certainly reach out to me if you want to talk about this. I'm at losangeles-chiropractor.com. I am board certified in pediatrics and pregnancy, chiropractic pediatrics and pregnancy, and certified in childhood developmental disorders, as well as have my diploma in homeopathy. And I do all the things to help support wellness and the body when it's working and needing some immune support. So I hope you found this helpful. Please give me that thumbs up if you did find it helpful. And send me a comment on how you are helping support your child's immune system while they have a fever. All right, I will see you next week, and in the following weeks, I will be talking about support for fevers using homeopathy and essential oils. Thanks so much, and see you next time.